Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzo.
And I'm Dr. Brad Weenie.
So today, I just wanted to do a short video on complications of total knee replacement.
Okay, there are a lot of them, but thankfully it is very, very rare.
Very rare, but you should know about them if you're going to have your knee replaced. So what do you tell patients?
So in my office, regardless of the procedure, I tell people there's always risk with any operation of an infection, a blood clot, heart attack, stroke, death. And I say if you can think it, it could happen, but it probably won't.
Okay. Similar to what I say, I tell people, look, we're going to do surgery for your knee replacements coming up. The risks are heart attack, stroke, death, blood clot, infection, neurologic injury, vascular injury. I say bad things can happen, but we take precautions to minimize the chance of something bad happening. And the chance of something bad happening is very, very, very small.
What about with respect to the total knee specifically, Paul?
With the total knee itself specifically, you can have numbness on the outside of the incision. The artificial knee can make clicking or clunking sounds. And probably the biggest complication or risk is that you're not entirely satisfied with your total knee. You still have pain after, and we've made some videos about this.
Yeah, I tell people you're not going to be perfect, you're not going to be normal, but you'll be drastically reduced in pain. The other thing I tell people is that theoretically you could either have a loose knee or a stiff knee. Those are specific things about knee replacement that I talk about.
So we don't mean to scare you off, but we want you to be informed. If you're going to replace your knee, you should understand the risks, and those are most of the risks that could possibly happen. Thanks for tuning in.
See you next time.
And remember, you are in charge of your own health.